A lot of hearings on the Hill today, and this one is still underway right now on Capitol Hill. The HHS Secretary Robert F. Kennedy Jr. testifying before the Senate Help Committee, and it's the second time that he has appeared today. He was in front of the House Committee this morning. So at an earlier hearing on the House side, he was pressed on his vaccine stance, pressed on a lot of things. Also, the recent letting go of 20% of the people at the agency. Watch.
Did somebody get Elon Musk's computer and say, okay, just make 20% cuts? Do you know if that happened?
I disagree with your entire characterization. It was like the recitation of a narrative that, everybody knows out there. And it's the Democratic Party narrative. I don't think people should be taking advice, medical advice from me.
Right, no, I got that. And I'm not asking you to give them medical advice, but would you vaccinate your child for measles?
If I answer that question directly, that it will seem like I'm giving advice to other people, and I don't want to be doing that.
So that's kind of what happened in there this morning. Dr. Asim Malhotra was just announced as Chief Medical Advisor to Make America Healthy Again, or MAHA Action. It's the group that Dr. Malhotra says advises the HHS. He is a consultant cardiologist based in London and making his way to Washington to begin his new role. Doctor, very good to have you here. I guess, first off, as you watch this back and forth with Congress and you hear people pushing back on some of the cuts that have been made to HHS and talking about vaccines, talking about food dyes, what do you think about how difficult it is, although they've made a lot of progress, to get stuff done in D.C. and what you're signing up for?
It's a great question, Martha. Well, thanks for having me on. I think that, this was inevitable, these sorts of conversations after, the MAHA initiative started. Of course, things are very partisan in America. So people are, just for the sake of really attacking President Trump or the Republicans, are going to be critical anyway. But the conversations need to happen. We need to heal this divide. We need to, everybody, I think, across the board wants to have the best possible health. They want to live into society that's healthy. America is suffering very badly, like many other countries, like the UK as well, where I'm from originally. And I think that, this is an inevitable part of this journey. But if there's anybody that can handle this, and any person that has been picked who's best to lead this movement in health, is Robert Kennedy Jr. I remember in 2022, Martha, I had to do something which was very challenging for me. And that was to change the narrative, reverse my own narrative on the safety and effectiveness of the COVID vaccine. I took 2 doses. I went on Good Morning Britain in the UK to say it was safe and effective for high-risk people. And, partly through a family tragedy, my dad having a sudden cardiac death, and then obviously real-world data coming out. By the end of 2021, the situation looked very different. I published a paper, end of 2022. I said, we need to pause this. I went on one of the TV channels in the UK, and it was a nervous time for me, but I felt it was my duty and responsibility to do that. The first person to call me as I left the studio of GB News, for the first time, I hadn't had any interaction with him. He got my number from somebody, was Robert Kennedy Jr. And he said to me, Dr. Malhotra, it's Robert Kennedy Jr. here. I want to thank you for your courage. He'd read my peer-reviewed papers. He interviewed me afterwards. And I realized, actually, this is somebody who is so open-minded to listening. Now, of course, he's got his views and he's known through the media of having certain views on things. But I think what we've seen emerge when he's taken this role as HHS Secretary is a man that is willing to listen to all sides and get involved in that discussion. And that's what we need. We need, he said also, in a Rescue the Republic rally, which took place in DC before the election, he said something which really resonated with me. He said, the solution to bad speech isn't censorship. It's more speech. It's better speech.
Yeah. Well, so he was censored on social media during all of COVID. Dr. Malhotra, we thank you very much. We look forward to seeing you in Washington and hearing more about what you're going to do. I know that taking action on sugar as a cardiologist is one of the things that you feel very strongly about. And we look forward to talking to you more. Thank you, Doctor.
Thank you, Martha.